Okay, I'm Constance Nyamukapa as introduced, and I work for the Manicaland Center for Public Health. Okay, for Public Health Research, and I've been with the organization for a very long time, though I am a late bloomer, trained as a social worker initially, and then when I was at college, I was very much interested into research, so I decided to divert from being a social worker into a researcher. And my main role has been to be the director for the center, as said. But I would also want to say, within the same project that we work, we have somebody from the Ministry of Health, so we don't do research for the sake of writing papers. We do research for the sake of bringing change to the population in Zimbabwe. So whenever we have a new project, we take it to the ministry people and say, guys, is this gonna work for you? Is it gonna work for our population? What is it that we need to do more within the research itself for us to bring change in terms of reaching our 90, now Zimbabwe is talking of 95, 95, 95. And we seem to be doing well. If we work together, we will do well. So my presentation, I would not want to own it. There is a bigger team behind me. We have Professor Morten Skovdal, who is in Copenhagen, who is more of our qualitative expert, and he does qualitative. We are more of the implementers in terms of research, and we also make sure that whatever results we get, we feed it to the right people. So I'm not going to give prescriptions at the end of the presentation itself. I'm just going to leave it to us to discuss how best can we navigate this very tight rope that we're talking about. Which one is? Oh no, I've gone to the right to the end of. Then I need to go to the next slide. Sorry, the names, okay. So I have no conflict of interest. The project was funded by the National Institute of Mental Health and the Bill and Melinda Gates Foundation. And the question that we were trying to answer when we did this qualitative study, and also we had some quantitative aspect to it, was why are we still having young girls and adolescent girls and young men who are still getting infected with HIV/AIDS when there are a lot of prevention methods out there. So we wanted to find out from the young girls themselves, what is it that is stopping them from using the prevention methods? Thank you. So like introduced, we have gender matters within the activities that we're doing. 6 out of 7 new infections among 15 to 19-year-olds in sub-Saharan Africa are among girls. And what are the risk factors for this? Early sexual debut. We had a focus group discussion with some of the young girls and say, we wanted to find out from them, when are they starting sex and who are they having the sex? We discovered that now girls are starting sex as early as 9 years old. We had a counselor within the focus group discussion. We all asked them whether she wanted to be part of it so that people understand. 9 years, and where are the places where you're having sex? In church, when you go for when you go for church meetings, when you go for school sports, when we go for any other gatherings, things are happening behind the church, behind the school, or behind the trees in the orchard. And then the sexual relationships are mainly with older people. And some of it is transactional sex, and some of it is coerced sex and intimate partner violence. We also had a study before where we were asking women, which was a bit, I'm sorry to say, my African counterparts. We had a question which said, when you had your first sexual act with your boyfriend or your husband, did you initiate it? Or did you have a part in it? The results were shocking. So there is a lot that is happening. Nobody, most of us as women, we are not enjoying some of the sex that people think, I'm in a marriage, I'm enjoying it. No. It's coerced sex, forced sex. And our partners go, there is no rape within a marriage. Those are some of the issues that we're finding. So this is, okay, thank you. So when PrEP was introduced, it was held as a promise to provide women with their user control. Is this true? In theory, adolescent girls and young women can take PrEP daily without involvement of their male partners. Yes, it's true. Acceptability studies from different sub-Saharan Africa indicate that adolescent girls and young women who are interested in PrEP and recognize its potential. But we have issues. In practice, adolescent girls and young women face hurdles to their successful engagement with PrEP, partly explained by fear of negative reactions from healthcare providers. We have a paper to that effect. Lack of support from relatives and friends and partners. Fear of partner reaction, intimate partner violence, complicated PrEP adherence. And what is the role of gender expectations in shaping adolescents, girls, and young women's engagement in PrEP? So our study was a qualitative study, like I said. We did 12 interviews with adolescent girls and young women, and we also did 3 focus group discussions with adolescents and girls and young women. And then the Cornell's notion of emphasized femininity is more of the male dominance. This is part of a larger intervention within the Manicaland Center, and we had the ethical approvals given by the relevant authorities, both in Zimbabwe and from our collaborating institutes overseas. Adolescents, girls, and young women who live in a men's world. Men were talked of as the head of household, the one who makes all the important decisions. Men are said to have the upper hand, whereas women will have to listen. This is not the qualitative, I'm talking about the quantitative. We have a household questionnaire, and then we have an individual questionnaire, which is so intimate and sensitive. So you get to a household, you ask for the head of household first, in order for us to be able to find out who are the people that we would want to talk to within the household. They're 15 to 19-year-olds. So sometimes we are denied information because the head of the household is not there, or we get the information on the household, and if you want to get to a participant who happens to be the wife to the head of the household, the woman will say, you have to wait until my husband comes in order for her to answer questions about her own sexuality. Patriarchy limited adolescent girls and young women's sexual decision making. It was mentioned that being a woman means that you have to sexually satisfy your husband. It is a matter of being controlled by men. Patriarchy not only puts them at risk of acquiring HIV, but challenges their engagement with PrEP as a means of protecting themselves. Stigma as a gender control mechanism affecting PrEP use. PrEP is perceived to violate expectations of what it means to be a good girl, not engaged in premarital sex or extramarital sex. In our context, I think where we work in one of our sites, there was the issue of virginity testing, but it has been stamped out, but it still happens beyond. So what a good girl is, when you're getting married, there are other practices that also happen behind the doors. You get married, the first night that you're going to be sleeping with your partner, it has to be done with the aunts having put a white sheet on the bed where you're going to be sleeping, so that they will be able to check whether you are a virgin or not. So for that, if I want to PrEP, people will go, already she has started sex. What's the point of marrying her? Adolescent girls worry about being judged and labeled as loose women or sex worker. And the other thing that we do, I'm sorry to say, when we are introducing programs, when we went to our study site, the first people who had PrEP tested on were commercial sex workers. And then that spiraled out of hand. Now they're getting PrEP. She is a commercial sex worker. We have spoken with commercial sex workers. They are people. They also want to have fun just like you and me. And when they go into it, they are not going there to get HIV or to do any mischief. We have to remember that every day. What I want, they also want. They are people, they are my brother, they are a sister, they are an aunt. Anticipated stigma constitutes a more hidden form of gender control mechanism that affects adolescent girls and young men's decision-making regarding PrEP. There is stigma attached to young women who go looking for PrEP because it tells the community that you are sexually active. Everybody has to know. How do they know? Because even the healthcare worker, remember some of these are elder women who can't keep to what they are doing at the clinic. I become a mother, I am a father, and then that father person takes over the nurse that is supposed to be sitting in front of this kid who is seeking help. And they go, why do you want PrEP? That's the first question. And does your mother know? And does my mother know means I'm going to snitch on you. Next. Few adolescent girls and young men believe they could take PrEP secretly. Most of the adolescent girls and young men say that PrEP use, or at least consistent usage, would be impossible without their partner or parents' permission. Many did not believe that their parents or partners would be supportive of PrEP. My husband will refuse that is use of PrEP. At the end, you reach a dilemma because you can't go and ask your husband's decision to use PrEP. And then somebody went, I will be willing to use PrEP, but my parents may discourage me or refuse me to use it. There are not a lot of parents who will agree their children to use PrEP. They don't even want to hear about it. The discussion is closed as soon as you start. Mom, I think I'm sexually active is a taboo. Next. And then the struggles of adolescent girls and young women to keep PrEP use. You see, then eventually I decided to go and access PrEP, but when I want to take the pills, at home, it becomes a challenge because my husband will always be at home. And at home, we don't have proper bedrooms. Wherever we might have a small suitcase where everything is tucked in. If you want to go in the suitcase, he wants to find out what exactly are you doing, and it tends to be violent. Keeping PrEP hidden for parents and partners is a challenge. Privacy is challenged by the very same gender norms and forms of social control that require men, adolescents, girls, and young women to engage with PrEP in secret. This is a school-going child. My mother used to get into my room and move stuff around. At times, you would come from school and she would have turned the whole place upside down. So, where to put PrEP pills is a challenge. And then the takeaway messages. PrEP is not simply a user-controlled HIV prevention technology. Its effectiveness is highly dependent on the complex social fabric that adolescent girls and young women are part of. Many, not all, adolescent girls and young women in Manicaland are exposed to forms of good girl expectations, which, when enforced, those stigmatization and social control mechanisms affect adolescent girls and young women's ability or inability to engage with PrEP. Some adolescent girls and young women face dilemmatic choice. First, the social risks of engaging with PrEP, such as stigmatization, or even violence, or even abandonment. You're just out of the house. Now, because you're having sex, you think you are older and you know how to look after yourself. Go and do it outside this household. Refrain from engaging with PrEP, or accept the increased risk of acquiring HIV. So if I don't use, then I am at risk. Okay. So in conclusion, perceived social risk outweigh the perceived risk of HIV, obstructing adolescent girls and young women's uptake of PrEP. PrEP is a potential to enrich the adolescent girls and young women with a more fulfilling sex lives, allowing them to focus on pleasure as opposed to fear and worry about HIV, is hampered by gender norms and expectations. Thank you very much.